of the most common questions I get asked when rehabbing active adults and participants in country club sports such as golf, tennis, pickleball, and Pilates is based on my injury. How long should I expect the healing process to take? And what can I do in order to maximize or speed up my recovery to eliminate or reduce the downtime experience from the activities I love doing? So super important to cover this topic to give people a realistic expectation on what the recovery timeline will look like, and give them the motivation in order to try and maximize that by doing everything that they can do in their formal rehab in order to speed up that process. So, with a soft tissue injury, including a muscle strain, which is where we tear a certain portion of the fibers of the muscle, common in, again, active adults, people that are stopping and starting quickly with lower body injuries like calf injuries in pickleball players, or with rotational sport athletes working on straining some of the muscles around the torso, like the obliques with golf, is that we'll find that they will suffer a muscle strain, which, depending on the grade of the strain, again, this is based on what percentage of the muscle is torn. We'll have pretty variable timeframes for which we'll expect that tissue to recover. So, for more of a minor strain, we're going to expect maybe 1 to 4 weeks for that muscle to fully heal. And we're going to do everything that we can to try and improve some of the circulation to the area, gradually start to work the muscle as well as the other muscles around the area without overworking them. Now, grade 2 is going to be a more sizable strain or tear in the muscle. And we're going to have a significantly longer healing time frame, in between 1 to 3 months with this. And we're going to have a more gradual or graded rehab process. And super important to work with a qualified professional who is going to ensure that you are doing enough at the right time, but not overdoing things as well in order to set yourself back. And then a grade 3 tear may actually require a surgical intervention. Will be super important to get screened by an appropriate medical provider after having this injury occur to determine whether or not you are a candidate to start off with rehab initially, or if you do need to pursue more invasive options such as surgery to ensure that you are able to make a full recovery in the end. With tendon injuries, which in more of the short term, where we do a lot of repetitive activity, maybe our body wasn't quite ready for starting a new sport or new activity, or we went out and played an entire tournament over a weekend when we're used to only playing a sport or doing an activity once or twice a week. We can flare up some of our tendons. Our tendons are what attach our muscles to our bones. And we can start to develop what's referred to as tendinitis. So there's some inflammation around our tendons, and this can be variable, but generally has a good prognosis as long as people are offloading some pressure from that area while still staying as active as possible, so that they're not adding additional inflammation back to the tendon, but they're also not resting entirely. And a realistic time frame for somebody to heal from this type of injury can vary based on how compliant they are with their physical therapist recommendations, but this can range between 3 and 7 weeks or more. Now, if that tendon issue becomes more chronic, it can progress into what we refer to as tendinosis, which is more of a chronic breakdown of the actual strength of the tendon itself. And this can be a much more lengthy rehab process. I'll typically tell people to expect at least the amount of time that they've been experiencing pain or issues with that tendon for, that if they do the right things, that they can expect about that length of time in order to fully rehab or recover that tendon. Fortunately, when working with an experienced professional who treats people day in and day out, who are in your exact shoes, you're able to make that timeline usually closer to the lesser number rather than the greater number over here. When it comes to ligament sprains, which is a ligament is what attaches a bone to another bone and helps to prevent excessive movement between the areas, we can have a pretty variable recovery timeline, in between as short as 2 weeks and a very minor sprain, all the way up to a year or more. Oftentimes, in the event that we completely tear a ligament, such as is the case when we have an ACL tear or an Achilles, an ACL tear, and we need a surgical intervention for that. And then we have to go through the entire rehab process to try and strengthen things back up. In things like an ACL tear, we actually are inserting a tendon oftentimes to replace the ligament. And so there's an extended time frame that occurs when the tendon actually needs to convert over and to become a ligament. And so this can be really variable. Again, is going to be accelerated by working with somebody who has extensive experience treating the issue that you are dealing with, and then also knows what you're trying to get back into doing, which is, again, super critical that you're working with somebody who participates in or is very familiar in treating people who want to get back into the activities that you desire to do. And then our last kind of few orthopedic tissues that we are consistently rehabbing with people are going to be people who have suffered an injury to things like their meniscus or their labrum in either their shoulder or their hip. These are cartilage complexes that are outside of the actual cartilage on the surface of the bone. And these can take significantly longer to recover due to poor blood supply, with the healing time frame being as variable as between three months and a full year. Again, some of this has to do with if some people have a surgical repair, and then the time that it takes to recover afterwards and fully rehab things to a sufficient level to allow people to get back into their activities of choice. And then our last structure is actually our bone. And bone has significantly better blood supply than our ligaments and our other cartilage complexes like our meniscus and our labrum. And because of that, bone actually heals significantly faster with variable timeframes between 4 to 6 weeks, all the way up to 8 to 10 weeks plus, depending on the location of the fracture and the size of the fracture as well. So, in summary, can be pretty variable in terms of how long it takes for the body to heal a specific tissue. As an overall rule of thumb, the healthier the individual is on an overall basis in terms of doing everything they can right with their nutrition, staying hydrated, staying well rested, getting good quality sleep, as well as working diligently with an experienced physical therapist or rehab professional, and in some cases, an orthopedic physician as well. People can speed up this time frame significantly, and they can minimize the risk of setbacks along the rehabilitation or recovery continuum, as well as address other movement patterns or shifts that occur when people are in pain or in injured, to try and minimize the downtime associated with trying to fix some of these compensation strategies that people developed when recovering from a pain or an injury. So, if you are interested in learning more about your specific injury and what your expectations can be in terms of how long it should take to heal or recover from that injury, then feel free to reach out to us at contact@limitlessconciergephysio.com via email, or send us a message directly at 720-780-0011, either via text or phone call, and we'd be happy to give you a better idea of what your recovery timeline should look like and make sure that you are doing everything possible to maximize your recovery and get back in the game sooner rather than later.